Health information systems. You know, they're kind of the invisible engine that runs modern medicine. Every single doctor's visit, every prescription, every lab result, it all relies on this huge digital backbone. But it can feel super complex, right? Well, today we're going to pull back the curtain and decode this world of data, records, and networks. Let's jump in. So, picture this. We've all been there. You have to see a new doctor, and you're faced with that classic headache. How do you get your medical records from your old doctor to the new one? Is it really still fax machines or, I don't know, carrier pigeons? It feels like it shouldn't be this hard. And that's exactly the core problem that all this health technology is trying to solve. To really get a handle on this, let's follow his story. Let's meet John. John's diabetic, he's just moved to a new city, and he has to tackle that exact problem, getting his whole medical history to his new doctor. And that simple, relatable task, it kicks off a whole digital journey and shows us the very first layer of health IT. And this journey starts with the patient, with John, taking control. He uses something called a personal health record, or a PHR. You can think of it like his own private digital health file. It's a place where he can gather all his records from all his different doctors, giving him one single, complete story of his health that he controls and can share. Now, for the official transfer, John's old doctor can't just email a random file. There are standards for this. They use a format called a CCDA. The easiest way to think about it is like a universal translator for patient summaries. It's a digital template that makes sure when one system sends a patient's story, the other system can actually read and understand it. It's the first step to getting these systems talking. So, John's CCDA arrives at the new clinic. Where does it go? It gets imported into the clinic's digital brain, the electronic health record, or EHR. This thing is the command center for all of John's care at that clinic. So let's pop the hood and take a quick look at the 5 key things it does. First up, results management. Let's say John gets some blood work done. Those results go straight into the EHR. This is huge because it lets his doctor do more than just see the latest numbers. They can track trends over time, compare old results to new ones, and even graph his progress. It turns a bunch of data into real, actionable insight. Next, you've got point-of-care documentation. This is all about how the doctor actually captures the details of John's visit right then and there. They use structured templates, which means the data is collected consistently every time. And that's not just good for John's care. It's also absolutely critical for things like billing. Okay, but what about prescribing medication or ordering more tests? That's where CPOE comes in. It stands for Computerized Provider Order Entry. And with just a few clicks, John's doctor can electronically zap an order for a new prescription to the pharmacy or request more lab work. It's way faster, there's no sloppy handwriting to misread, and it's just a whole lot safer. Speaking of safety, this next one is a game changer, especially in hospitals. It's called Barcode Medication Administration. It's so simple, but so brilliant. A nurse scans the barcode on the patient's wristband, then scans the barcode on the medication. The system instantly checks if it's the right patient, the right drug, the right dose, the right route, and the right time. It's a powerful way to stop medication errors before they happen. And last but not least, there's the brain within the brain, clinical decision support. This is the really smart part. As the doctor is putting in an order for John, the CDS is working in the background. It might flash an alert that says, hey, wait, John's allergic to this. Or watch out, this new drug could interact badly with one he's already taking. It's like a smart co-pilot for the doctor, always looking out for potential problems. And here's how it all fits together. Results, documentation, orders, medication administration, and decision support. They aren't 5 separate things. They're all interconnected, working together. They form this tight, closed loop that helps manage patient care safely and efficiently from the moment you walk in to the moment you leave. But John's story takes an unexpected turn. He has an accident, and he ends up in the hospital. And all of a sudden, we're zooming out. We're going from his doctor's relatively simple EHR to the massive, sprawling technological universe of a modern hospital. And trust me, this is where things get really, really interesting. I love this analogy because it just clicks. Think of the hospital's entire IT setup as its nervous system. The EHR, that's the brain, making the big decisions. And all the other specialized systems in the lab, in radiology, in the pharmacy, those are the eyes, the ears, and the hands, feeding information to the brain and carrying out its instructions. So take a look at this. It's like a map of that hospital's nervous system. Right in the middle, you see those core EHR systems we just talked about. But look at what's surrounding them. All these source systems. You've got the lab, the pharmacy, specialized departments, all feeding information in. And holding it all together is the underlying tech that lets them all talk to each other. This brings us to a huge new challenge. John's health data now lives in at least two different places, his regular doctor's office and the hospital. And they might be using EHRs from totally different companies. So how in the world does the hospital get the info from John's doctor or the other way around? The magic word here is interoperability. I know, it's a bit of a mouthful, but the idea is actually pretty simple. It's not just about connecting two computers with a wire. It's about making sure that when data goes from System A to System B can actually understand it and use it. It's the difference between just hearing noise and actually understanding what someone is saying. So who manages all this? A lot of the time, it's a health information organization, or HIO. Think of an HIO as a trusted, neutral middleman, like a secure digital town square for health data. With John's permission, both his doctor and the hospital can plug into the HIO to securely share his records. The HIO handles the tricky stuff, like making sure it's the right John Smith and managing his consent. And these HIOs have two main ways of sharing data. The first is called direct exchange. It's basically like a super secure email system, where a doctor can push a patient's records to a specialist. The other method is called connect, and it's more like a search engine. It lets a hospital query and pull records from other doctors on the network. So you have push versus pull. Two simple but powerful ways to get information where it needs to go. Okay, so we've seen how all this tech works for a patient like John, but let's flip the script. How does a doctor's office or a hospital even choose one of these complex systems in the first place? Let's take a look at a quick case study. A small pediatric practice, the Clinic for Kids, that needs to get a new EHR. They can't just pick one out of a catalog. There's a formal process for this, called the Systems Development Lifecycle, or SDLC. It's a really logical 6-step loop. First, they figure out exactly what they need and set their goals. Then, they make a detailed list of all the features they have to have. Only then do they go find a vendor, put the system in place, train everybody, and set up processes to maintain it, and, finally, monitor how it's working. And you know, the most important part of this whole thing is that it's a cycle. See how that monitor step loops right back around to identify a need? That's because technology is always changing, and so are the needs of the clinic. The SDLC isn't a one-time project. It's a continuous loop of improvement, making sure the tech is always doing what it's supposed to do for patients. So there you have it. We've gone from John's personal health record all the way up to the massive nationwide networks that connect hospitals and clinics. This whole digital ecosystem, this is the backbone of modern healthcare. It's what makes a more data-driven, value-based future even possible. And that brings us to the final and maybe the most important question. The technology is incredibly powerful. It's connecting our most personal, sensitive information in ways we've never seen before. So the challenge for all of us isn't just about building better tech. It's about building trust. How do we, as a society, make sure this vast network of data is always used wisely, ethically, and for the benefit of every single patient?